Irritable bowel syndrome, or IBS, is a chronic functional disorder of the bowel. The word functional means that the structure of the bowel is usually normal, and the routine diagnostic tests are not very useful in diagnosing IBS. IBS is very common, affecting 1 in 10 people in many countries. It is twice as common in women as it is in men. The symptoms of IBS are variable, ranging from mild abdominal discomfort to severe abdominal pain, bloating, changes in bowel habits such as constipation, diarrhea with mucus, or alternating between the two. There are 4 subtypes of IBS according to the predominant symptoms. IBS-C features pain and constipation mainly, while IBS-D has diarrhea as the predominant symptoms. There are also IBS-M with mixed diarrhea and constipation, and IBS-U, which covers everything else. Symptoms often get worse after eating, may improve with bowel movement. Although the symptoms of IBS may subside, IBS doesn't completely go away. So why do some people have IBS but others do not? There is no easy answer to this question. The most popular explanation is that the microbiota, or the living ecosystem in the intestine of IBS sufferers, have somehow changed. In particular, some gas-producing bacteria are enriched, while other gas-utilizing species dwindle in number. These gas-producing bacteria use the undigested food to produce large amount of gas, which provokes symptoms like bloating and the often embarrassing farts. To make it even more complicated, there are also other changes in the body. The gut lining becomes more leaky, which causes certain food molecules to pass through and inappropriately triggers an immune response, causing low-grade inflammation. Increased sensitivity in gut neurons, which are nerve cells which transmit signals back and forth to the brain. This makes the gut sensitive to stretch. Disturbance in the nervous system triggered by anxiety and stress can negatively affect proper functioning of the digestive system through the brain-gut interaction. So what is the treatment of IBS? IBS cannot be cured, but the symptoms of IBS may be effectively managed. The treatment of IBS generally involves an integrated approach, which consists of dietary changes, lifestyle modifications, medications, and psychological treatment. In this video, I will focus on the dietary and lifestyle management of IBS. There is no single best diet which works for every IBS sufferer. There has been a growing interest in low FODMAP diet, which was developed and popularized by a team of Australian researchers. FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. They are short-chain carbohydrates resistant to digestion. When these carbohydrates travel to the large intestine, they can be fermented by bacteria to produce gas, which can worsen the symptom of IBS. Even though this diet has shown some benefits to IBS, it is not a magic bullet. The diet involves eliminating many food items commonly regarded as components of a healthy diet. Not only can it be difficult to stick to for long term, but it may also lead to nutritional deficiency. For this reason, it is best to seek professional advice of a dietitian. The other problem with low FODMAP diet is that there has not been enough evidence to prove that this diet is superior to conventional dietary advice. Incriminating certain food items to IBS symptoms is difficult. Specific food may cause problems in some patients, but not others. Only a small portion of potential foods are identified in formal studies, so dietary changes can be a bit of hit and miss. With that being said, there are some useful dietary advice for you to consider. Avoid missing meals or leaving long gaps between eating. You should eat regularly and take your time while you eat. Limit your caffeine intake. Restrict tea and coffee to the minimum. Keep hydrated with plenty of non-caffeinated drinks throughout the day. Drink less alcohol and fizzy drinks. Eat less processed or reheated foods, which generally contain indigestible starch. People with diarrhea should avoid sorbitol, an artificial sweetener found in sugar-free sweets and drinks. Have soluble fibers, but avoid insoluble fibers like wheat bran found in bread and many breakfast cereals. How about the role of prebiotics and probiotics? Despite the similar names, they are not the same thing. Prebiotics are non-digestible food ingredients that act like manure to grow good bacteria in your gut. Probiotics, on the other hand, are live good bacteria, which can be found in yogurt and other fermented foods. They both have some benefits to the symptoms of IBS. As long as they do not cause you any problems, they can be a part of your IBS treatment. Now let's talk about lifestyle interventions. The role of physical activity to improve IBS symptoms is contentious. Some evidence suggests that exercise can reduce the transit time of your food through your gut, which can minimize the risk of bowel cancer. However, exercise does not relieve constipation or diarrhea. In fact, vigorous exercise such as running can worsen diarrhea. Having said that, for general health benefit, a minimum of 30 minutes a day of moderate intensity activity for more than 5 days a week is still your best bet to live a long and healthy life. To recap, IBS is a common gut problem. Its exact causes are not clear. IBS cannot be cured, but can be managed by better lifestyle choices. If your IBS symptoms are not under control, visit your doctor for further advice.